always ask every single patient, what was your first symptom? Because number one, I'm curious, because I learned through the patients, and she told me, she goes, well, I had a cold, and then it never went away. And after months and months of fighting this cold, she finally told the doctor, like, what are you gonna do? Can't you send me somewhere? So unfortunately, she was sent to the ENT. The ENT did an indirect laryngoscopy and found squamous cell cancer. So again, anybody who has anything that's not getting better quickly, if something's not gone in a month, and you should have a reminder on your computer, like on my computer, I have a reminder, check on that patient, make sure they're better. Because theoretically, you're responsible. If they have abdominal pain and it's not gone and you didn't follow up with the patient, you are responsible. I hate to say it, you're responsible. So just make sure and document, pain, all nausea, all whatever it is, completely resolved. But patients don't have to have one of these symptoms to have cancer. So no symptoms, and obviously any of these symptoms, everything needs to be worked out. Everything, okay? So, and like some of the things aren't even on here, like women and get imaging, they get breast ultrasounds. Like you don't know how many people have a breast ultrasound and they have a little cyst. Oh, they have dense breast on their mammography. They have, little things. There's nothing that appears malignant, okay? Until you will save yourself and the patient by doing really, really, really good workup. You just will. I'll tell you a story that is probably the most starstruck story I've ever had in my practice. One of those starstruck. So I had a patient come to see me for menopause. And she knows me, because a lot of all patients usually know me before they come to see me. They're told by a friend or they watch YouTube or something. So she came in, she's 50 years old. There's Connealy, I'm having helpless, I can't even live. I said, okay, you're probably going through menopause. So let's check all your hormones. And I said, okay, when was your last mammogram? You've got to practice the standard of care. If the patient refuses, document, patient refuses XYZ. And they understand the risk of this decision. So please make sure you do documentation, because your patients are going to refuse mammograms, colonoscopies, bone dead, whatever it is, they're going to refuse. So just make sure you document. So anyway, she says, I said, well, you want to do it's time to do a colonoscopy. So and bone density and whatever else I said, okay. So most of the time I have to tell you my patients refuse mammography, they want to do thermometry. So anyway, she goes and gets a colonoscopy, like pretty soon, like a couple weeks after her visit. She calls up the office, she says, I need to see Dr. Connealy right away. They found a 5-millimeter little patch at the end of the colonoscopy. When they were getting done, they pulled out right in the verge of the colon and rectum. I need to know if I have cancer right now, because she knows I do that. So she comes in, we order an Oncoblot, which is a liquid biopsy that is not available now. The new company is called IVG. So we also ordered circulating tumor cells from the lab, RGCC, and then we did bioenergetic testing. And so in the meanwhile, she is scheduling with the colorectal surgeon to get a biopsy. What is a biopsy? The standard of care. Biopsy is the standard of care. Now, patients also have the right to refuse biopsy. Okay, they have that right. So whatever it is, you don't make the decision for the patient. Patients make their own decision. If you know about placebo and nocebo, you've got to let patients make their own decisions informed. You inform them, but you don't make the decision. Because like people say, well, Dr. Connealy, should I get radiation? I said, I really can't make that decision. I said, you have to get the information, because if a patient, you tell the patient, no, don't get radiation because it's terrible, don't ever do that. You just say, well, look, here's some resources. You've got to go look and research yourself. This is your body. You really need to be happy with your decision. Because if the patient, let's say, God forbid, the patient doesn't get radiation and their cancer comes back in 6 months, your ass is mud. So anyway, let's go back to the case. So anyway, she gets her appointment with the colorectal surgeon, and she can't get that for about a month. So in the meantime, all of her tests come back. She's oncoblot positive for colon cancer. Her circulating tumor cells were 6.3.
Which is elevated,
yeah. 6.3. It should be 0. You're 0. Theoretically, you should have 0. That's definition of remission and cure of circulating tumor cells of 0. And then her bioimmune survey, colon cancer. So I put her on a protocol. Patients, gung-ho, I want to do IV vitamin C, I want to do this, I'll do this, and I put her on a whole protocol. Emotional work is always eating and emotional work is my number one thing. First thing they do. So I go, we'll slowly do these other things, but the learning how to eat and learning how to think are the top two things. So anyway, she goes to see the colorectal, gets the biopsy. What does it come back? Negative.
Thank goodness it was a month till she could see him.
Negative. A negative biopsy doesn't mean you don't have cancer. Yes, it is the standard of care, but think about it, what you can do, the difference in what you can do in your practice, because you're going to find fibrocystic breast may be really cancer. You don't know how many patient stories I've heard, and I'm always interested in the story for me.